when you realize that somebody needs CPR, it is first, like the best thing that you can do is to check the scene to make sure the scene is safe. So after you check that the scene is safe, you will yell at somebody else to go call 911 and get an AED. You will be like, hello, can you hear me? Tap them. That way, in case they are like emotionally conscious, they can move, and talk to them in case they can hear you and tell them what you are doing. Check and hear if they are breathing. You can put your hand, like your ear near their mouth, or you can feel their chest to see if the compressions are going up and down. So then after that, you will put your hands on the chest, like towards the center, a little bit lower, and map your fingers together like this. You will do 30 compressions in and out, and they should be about 2 inches deep when doing it in adults. So make sure that you go down far enough. Then you will make sure that the head, so like this will be the head now, is tilted up just enough, that way there can be airflow going through the body. You will do 2 breaths, and if that does not work, you will go back to doing compressions and do this for as long as you need until other help can arrive. Then after doing these breaths, you will use, if help still has not arrived, you will use an AED, which should have been brought to you by the person who called 911, and put one pad, thank you for that, and put one pad here and then one more down towards the side, and then plug it in. And then if it's on an infant or a child, make sure that you try to find the pads that are pediatric. When you think somebody is choking, the proper thing to do is give them the Heimlich. So if you think they're choking, the first thing you do is you have to ask them if they're choking. And clearly, if they're choking, you're not going to be able to respond. So they may go like this, you know, kind of act like they're choking. So just be aware of that they might not respond with a yes. So what you're going to do is you're going to tell them what you're doing as you do it. You're going to take one hand and put it in the abdominal cavity, and then put your other hand on top of it for more power. So you're going to thrust inward, just to like make sure that you are trying to remove the object that is clogging the airway. If you're doing the chest Heimlich, you go up just a few inches higher than the abdominal one when doing this. And if the person stops responding, this is different than regular CPR because they cannot breathe, because clearly there is something stuck in there, so the airway would not work.